Hello, sir. How are you? I'm a first-year medical student. I'm currently enrolled in the practice of medicine course. May I conduct your medical history and physical exam? Hi. Yes. You may. Great. So what brings you in today? I was feeling some shortness of breath this morning when I awoke. While getting ready for work, I developed some chest pain and dizziness which has progressively worsened over the past 4 hours and is now crushing pressure on my sternum that is radiating up my right arm and neck area. It is very intense, like an elephant sitting on my chest. The pain is quite severe. I have also begun to sweat profusely. Can you tell me more about that? What? Can you tell me more about that? I have acute chest pain. It is severe. Could you quantify the pain for me? On a scale of, it is a 10 out of 10. Okay. And do you have any history of medical problems? Yes, I have diabetes, hypertension, obesity, atrial fibrillation, hypercholesterolemia, and a history of ischemic heart disease. 5 years ago I had 2 coronary stents put in. Can you tell me more about that? I had 2 stents placed in my coronary arteries. This was to restore their patency, to ensure that my heart muscle can be perfused with oxygenated blood, preventing it from becoming hypoxic and dying. Do you take any prescription medications? I gave the list of them to the paramedics on the ambulance. They gave it to the triage nurse. What about over-the-counter medications, homeopathic remedies, or herbal supplements? Do you take any of those? Do you take any illegal street or recreational drugs? No, I do not. Do you have any family history of medical conditions? Yes, my father had a heart attack and died at age 47. Both of my younger siblings, who are in their 40s, also have been diagnosed with coronary artery disease. Can you tell me more about that? Why do you keep asking me that? I'm asking open-ended questions so as to avoid influencing your responses and to glean additional information. It is just part of taking a thorough medical history. We learned it in POM. Do you engage in any physical activity on a regular basis? I have a sedentary lifestyle. What is your family life like at home? It is unremarkable. With what ethnicity would you say you most closely identify? Have you ever been hospitalized? Yes, when I had my coronary stents put in. Any tobacco use? Yes. 2 packs per day for 30 years. We have some smoking cessation program pamphlets. Perhaps you would like one. Any alcohol consumption? No. Caffeine? No. And how are your energy levels? I have acute chest pain. It is severe. I'm sorry to hear that, sir. But first we must conduct a thorough medical history. Most diagnoses are made from the history. We learned it in Palm. Do you have any shortness of breath? Yes, secondary to acute chest pain. It is severe. And how has your digestion been lately? I vomited on the ambulance on the way to the hospital. Can you tell me more about that? Okay. I think we have finished the medical history. To summarize thus far, you have been experiencing acute crushing chest pain and shortness of breath, with a well-documented history of coronary artery disease, significant familial history of heart attacks, 60-pack years of cigarette use, and nearly all the major known risk factors for heart attack. Next, I will perform a musculoskeletal exam. This will assess your brachial and patellar tendon reflexes. But first, I will palpate medially and laterally to your ankle malleoli. Any tenderness,